Hello, I'm Heidi. I'm a registered veterinary nurse. I've been working at Woodgreen for over 20 years now. I am the rabbit specialist nurse, and I'm here to talk to you today about caring for your rabbit after they've been neutered.
When bringing your rabbits home, please bear these things in mind. Rabbits in pain will not eat. Stressed rabbits are likely to eat. Most rabbit confident practices will have asked for the bonded pairs to attend the surgery together and will have requested that you bring in some of their favourite food and treats for their recovery. Your rabbit will be home when the vet team are happy that they are awake and have shown signs of wanting to eat. Your rabbit will still be feeling the effects of any medication and anaesthetic drugs they were given, so make sure they are kept warm enough and are not able to fall from anything of height in their enclosure when you put them back in. Make sure their enclosure is clean and there is plenty of soft, green, sweet-smelling hay to encourage them to eat, and offer a variety of their favourite foods, such as freshly picked grass, dandelions or other forage items, or a handful of greens. It is really important to keep your rabbit's accommodation clean so that their wound does not become infected, and plenty of food options to encourage them to eat. One of the most important things for a rabbit after an operation is to get their gut moving again and to get them eating. Be mindful if your rabbit is part of a pre-mixed or bonded pair, if the other half has already been neutered. It may be useful to place them in a split mix for recovery purposes. This enables you to visualise that the patient is eating and drinking adequately, also passing sufficient amounts of urine and faeces for the recovery period. The split mix helps maintain the existing bond without watching them 24 hours a day, and to ensure the pair hasn't been greedy. Pairs neutered before sexual maturity can be operated on at similar times with little worry of impregnation following neuter. More care should be taken with adult pairings. Sexually mature rabbits should not be mixed and remain separated for a minimum of 6 weeks after the operation, as this is how long it takes for the male to become infertile. Your vet will likely have given you some medication to bring home with your rabbit. Make sure you follow the instructions on each label carefully to ensure your rabbit gets the correct dose of each medication at the right times of day. You must finish each course of medication as prescribed by your vet. If you have any concerns about the medication for your rabbit, always contact your vet for support. Your rabbit may initially be reluctant to eat after their operation. It is essential for rabbits that their gut is full of fibrous food and stays well hydrated. This helps ensure it is working at all times. A general anaesthetic at neuter can disrupt the gut mechanics, so the sooner your rabbit is eating again, the faster they will recover. Sometimes rabbits need a little help to encourage them to start eating with some of their favourite tasty treats, but if that doesn't get them nibbling, then you will need to syringe feed them. Your vet can supply you with a recovery feed, which is a palatable, highly nutritious powder form of rabbit food, which you make by mixing it with water until it is a paste-like consistency. So always follow the guidelines on the packet of food that you are supplied by your vet, and make sure that your rabbit consumes what it needs to within a 24-hour period. Be proactive with syringe feeding. It will help avoid any drastic deterioration in your rabbit's recovery. To feed, make sure your rabbit is on a safe surface where they cannot fall or jump. It is often easiest to have someone else secure them for you if you're not used to doing this on your own. Pop the end of the syringe into the corner of the mouth and push it gently towards the back of their mouth. Gently depress the plunger a little at a time and wait for the rabbit to chew and swallow the food before placing any more in the mouth. Avoid pushing too much in at once, as this can cause other issues with breathing. If you notice any wheezing or resentment with breathing, stop immediately. If you do not feel confident in syringe feeding, please contact your vets for assistance. Don't be scared to inspect your rabbit's poo. It can tell you a lot about their recovery. Fecal pellets should be large, round and uniform in shape. A minimum of 250 pellets should be passed a day per rabbit. They should crumble easily when rubbed between 2 fingers and not appear too dark, dry or hard. Following an operation, it's important to check their wounds. If your rabbit is a male, he will most likely have 2 small incisions where his testicles were, which will be sutured or most likely surgically glued to seal the wound. Scrotum may become swollen after the operation. This should reduce and return to normal within a couple of days. If your rabbit is female, she will likely have an incision along the midline of her belly. This will also be held closed with sutures and possibly sealed with surgical glue over the top. You need to check their wounds twice a day to ensure it is healing for the first week to 10 days after their operation. If the wound is open, weeping, hot to touch or swollen or firm, your rabbit may have an infection and you should take your rabbit back to see your vet to get further treatment.
So obviously it can be quite a nervous and anxious time when you have your animal neutered and for their recovery, especially with rabbits. They're a little bit more tricksy to deal with. However, following our videos, hopefully you can feel confident in monitoring their recovery, making sure that they are happy and healthy and living their best lives following the necessary procedures that they need to go through.